Good afternoon, everybody. Welcome to the informational webinar on strengthening Rocky Mountain spotted fever prevention and control in tribal communities in Arizona tribal lands. We're going to hold off just a couple more minutes before we get started in the webinar. If you are joining by computer, if you can please just enter in your into the chat your tribal affiliation or the organization that you are representing. That would be great. We'll get started here in just a couple minutes. Okay, it looks like we've had a slowing of people as they are joining, so we will go ahead and get started with the presentation. So thank you, everybody, and again, good afternoon. Thank you for joining us for our informational webinar for strengthening Rocky Mountain spotted fever prevention and control in Arizona tribal lands. My name is Naomi Drexler. I'm an epidemiologist with the Rickettsial Zoonosis branch. Today we're going to be providing some information about a new notice of funding opportunity, CDC RFA CK21-2102. This funding opportunity is being hosted by the Division of Vector-Borne Diseases in the National Center for Emerging and Zoonotic Infectious Diseases. Today joining me, I hope a little later on, we will have Brownie Anderson-Rana from our Office of Grant Services. And today's meeting is being supported in the background by Sue Visser, our Associate Director for Policy and Extramural Programs, Jeff Borchert, our Director of Extramural Programs, Gil Kirsch, our Branch Chief for the Rickettsial Zoonosis Branch, and several others. As we are coming online, I just want to alert you all that this meeting is being recorded. So we hope to have this video as well as the frequently asked questions available following this meeting, probably later on this week on our CDC website. The slides for today's presentation will not be directly available, but within the video recording, you should be able to see the slides as we go along. For the moment, I have everybody muted just to control the setting a little bit more. As we get back to the end of the presentation to some question and answer periods, we will unmute everybody so that they can join, so that they can ask questions either verbally or feel free to use the chat box. If you can, we would appreciate it if you would type into the chat box your tribal affiliation or the organization that you're representing, just so we have a record of everybody who is participating in today's call. And again, we will make all frequently asked questions or all questions available after this, this presentation. So If you're joining on the line, I'll remind everybody at the end that you can unmute your phone if you're joining by telephone by pressing *6. Otherwise, you can just unmute yourself on the graphic on the computer. So everything that we're going to cover today is also and already listed in the Notice of Funding Opportunity. So hopefully this will be a review and we'll get a chance to go through some quick questions. So here's the agenda for today's call. So we've already started with our welcome and introductions from the CDC side. I hope that you will join us with placing your tribal affiliations again in the chat box. And we will be using the chat box to monitor questions throughout this period. Feel free to type in your questions at any point and we'll just review them all at the end following the presentation. We're going to provide a short overview of the topic of Rocky Mountain Spotted Fever in Arizona and why this funding opportunity is being proposed. Then we're going to review the objectives and the overview of the NOFO, including the timelines, estimated awards, eligibility, and the major strategic activities which we're hoping that you all will be working within. We're going to talk about the objective review process very briefly and kind of outlining the major elements that all applications will be judged on. We'll then review the timeline of the application process. You'll have access to my contact information as well as that of Kathy Rabel, who's our main Office of Grant Services contact, and Brownie Anderson Rana, who is our other OGS representative today. And then we'll open up the floor for questions and answers. Again, feel free to type your questions as they come up as they occur to you, and we'll get to them all at the very end. All right, so Rocky Mountain Spotted Fever, or Rmsf, is a dangerous and potentially deadly tick-borne disease. As most of you are very well aware, tribal communities in Arizona have been impacted heavily by Rocky Mountain Spotted Fever starting in 2003. Prior to this time, there were few cases of Rocky Mountain Spotted Fever reported from this area. So since 2003, we have record of 6 communities that have been impacted with incidence rates in some areas more than 150 times higher than the average national incidence rate. So these are what we call hyperendemic areas. Following investigations in the early 2000s, we were able to determine that Rocky Mountain Spotted Fever in Arizona was being spread by a different tick vector than what we see elsewhere in the country. And this was the brown dog tick. The brown dog tick, is found throughout the world and is often associated with dogs. Their primary feeding and breeding site is on domestic dogs. So dogs play a large role in the epidemiology and control of Rocky Mountain Spotted Fever in these areas. These ticks also, because they are so closely associated with domestic dogs, they are well adapted for living in and around homes, creating high rates of exposure, unfortunately, to people living in the community. Brown dog ticks, again, prefer to feed and breed on domestic dogs, so large populations of free-roaming dogs are known as drivers that fuel these epidemics. While there are a lot of challenges associated with Rocky Mountain Spotted Fever, there are also some solutions. In 2012, tribal, state, federal, and private partners conducted an evidence-based intervention called the Rocky Mountain Spotted Fever Rodeo to control ticks on dogs and in the environment. This intervention used long-lasting tick control products, pesticides around the homes, and increased opportunities for community education, as well as spay and neuter of those community dogs. So all of these pieces working together are what combined into an integrated pest management approach, trying to control the tick from multiple sides, the dog, the home, and then making sure that everybody in the community is aware of the risks of Rocky Mountain Spotted Fever. This integrated program ended up reducing ticks around the home, reduced ticks on dogs, and also resulted in a 43% reduction of Rmsf cases within the test community. So we know that this is a proven intervention and has been the basis of Rocky Mountain spotted fever prevention in Arizona since that time. So these evidence-based practices have been adapted and used throughout Arizona tribal communities since 2012. They've been scaled to some extent in many areas. However, based on a 2017 needs assessment, we also know that impacted tribal communities have lacked the resources and often the infrastructure to sustain large-scale Rocky Mountain spotted fever prevention efforts. So the purpose of this NOFO is really to provide resources for tribal nations impacted by Rocky Mountain spotted fever. We aim to support the development and maintenance of Rocky Mountain spotted fever prevention and control within tribal communities by increasing the use of evidence-based interventions like the Rocky Mountain spotted fever rodeo. As you'll see later on, these can be adapted and tailored for your community. Another aspect we hope to engage is improving communication and education, and by strengthening Rmsf support services. So these can be animal control, vector control, and other services that impact the success of Rocky Mountain spotted fever prevention. So a little bit more about this funding opportunity. This is a 3-year, this announcement details a 3-year notice of funding opportunity. This is a cooperative agreement. So that basically means that this includes substantial support and collaboration with CDC as the funder. And we have the ability, as we've outlined within the NOFO, to provide technical assistance on several topics, including designing surveys, helping to create communications messages, designing strategies, and evaluation protocols. We anticipate making no more than 6 awards through this NOFO. The annual budget it may depend each year based on the availability of funds and the requests coming from each of the tribal communities, but at least in fiscal year 21, which is the first year of this cycle, we anticipate funding at $350,000, and that is the total estimated funding for all awardees combined. We have structured this award so that funding eligibility is tiered based on the burden of disease. We are using a catchment period of 2015 through 2020. So we have 3 tiers of eligibility. Tribes that have been that have had 1 to 10 cases reported during 2015 through 2020 are eligible for $10,000 to $50,000 per year. Tribes that have reported between 11 and 30 cases during that same period are eligible for $20,000 to $100,000 per year. And tribes that are have reported more than 30 or more cases are eligible for $50,000 to $350,000 per year. So higher tiers of funding are really geared towards communities that have been more heavily impacted. And you will see that in our objective review process, we ask that you provide evidence about your case burden in order to meet a successful application. This can be as simple as an email from your health department, from your state health department detailing how many cases you've had reported during that period, or from your tribal health department. We will accept, many different examples of numbers of case burdens. So please make sure that when you are putting together your request or your application, that your budget corresponds to the tier that you are eligible for. So it will be helpful to find out which tier, how many cases you've reported during 2015 through 2020, so you know about how much to be targeting in your application request. So a little bit about the eligibility. This funding opportunity is only open to federally recognized tribal governments. this is specific to only tribal governments, intended to be direct to tribe support from CDC. This funding opportunity has also been approved for a single award for up to 6 recipients. So only eligible tribal governments in areas that have experienced cases of Rocky Mountain spotted fever have been listed as eligible for this award. So this includes specifically the Gila River Indian Community, the Hopi Tribe, Navajo Nation, San Carlos Apache Tribe, Tohono O'odham Nation, and the White Mountain Apache Tribe. So these are the 6 entities that are listed, 6 tribal governments that are listed as eligible for this award. So I'd like to talk a little bit about how the strongest applications will be met, and we'll go over this a little bit more in depth when we talk about the objective review criteria. But the strongest applications in general will clearly and concisely discuss the state of Rocky Mountain spotted fever within your community during those last 5 years, so during 2015 through 2020, and provide information about the tribe's current Rocky Mountain spotted fever prevention and control activities. This gives us an idea of what is going on currently and then where you would like to grow with the support of this NOFO. Applicants should outline the purpose of the program that is being applied for with this funding. You should clearly identify the target audience of this program. Be able to outline the activities that you are being proposed. And as we'll talk about in a little bit more detail, at least one or more of these of your strategies needs to align with our program strategies. So we'll cover that in the next slide. This application should propose reasonable evaluation strategies to be able to track the success of what you are proposing throughout the period of performance. So again, it's a 3-year period of performance, and we want you to be able to show progress, reasonable progress towards your goals. And this applicants should show their willingness to support and share best practices with other recipients. That is something we feel very strongly about, is being able to share what's worked well across tribal communities, so that areas that can take lessons learned and see if it applies well in their area. So you don't have to be able to provide, specific identifiable information, but just be able to talk about what has worked well for you and maybe what hasn't worked well, so that other tribes can learn from your activities. Here's a little bit more about the target audience. So program activities and the outcomes of this NOFO should benefit tribal members living in the communities which have reported cases of Rocky Mountain spotted fever within the last 5 years. Applicants should clearly identify how their plans, capacity building, or quality improvements that you're addressing in this NOFO will reduce the impact of Rocky Mountain spotted fever in their tribal communities. You'll see that oftentimes the reduction of cases for Rocky Mountain spotted fever may end up being a long-term outcome. So we don't expect you to always be able to achieve that within the period of performance, but we do want to make sure that that is the goal in mind, the ultimate goal in mind of any of your activities that you propose. Communities will have the option, if they so choose, to target their program services to a portion of the population. So for instance, you can have a subset of housing districts propose targeting your activities only to a couple of housing districts that are most heavily impacted by Rocky Mountain spotted fever. But we would expect that you provide very strong justification about why you are targeting only a subset of the population. So please provide that evidence within your application. So here are those strategic activities that that we have highlighted in this NOFO. So we have 3 strategic areas, and applicants must write their proposals to align with one or more of these strategic areas. You are allowed to propose activities that align with more than one of these, but at least one has to be addressed within your application. So these strategic areas include to implement and adapt evidence-based interventions to reduce Rocky Mountain spotted fever. So this element can be achieved by either tailoring proven Rmsf prevention strategies to your community, or by conducting a process improvement to your current prevention strategies to make them more resource efficient, cost efficient, or just efficient. So that is an option. The second option, second strategic activity, is to develop, disseminate, and evaluate locally minded Rocky Mountain spotted fever communications, locally minded Rocky Mountain spotted fever communications plan. This will oftentimes include culturally appropriate messaging, adapting messages, generic messages for your community. And as you'll read in the NOFO, if you do select that strategic area, we do expect you to track some improvement in education and understanding within the community. So that might involve a pre and a post assessment or other ways of tracking increased knowledge or education. And then the last strategic area that can be addressed with this NOFO is strengthening Rmsf support services. So this can be, again, services such as animal control, vector control, or anything relevant, any other relevant services by, training, equipping tribal programs, or by using contracted services. So we do know that permanent resources such as veterinary services may not be available in all tribal communities, and building sustainable veterinary services, for example, may be outside of the scope of this project. So what we are looking for is that you build partnerships for ongoing support of those services, potentially through contracts and further partnerships. So again, you can propose activities that align with any of these strategic areas, one or more of them. We do ask that you propose something that is realistic for your programs, and that can be achieved within your funding tier. So please do also keep your funding tier in mind when selecting your strategic areas. Okay, so we are asking applicants to develop and submit a specific work plan for your activities that you plan to accomplish within the 3-year period of performance, as well as a more detailed plan for what you propose to conduct in year 1. Your plans should align with the strategic activities that you saw on the previous slide. Plans and activities should reflect the strategies, outcomes, and evaluation and performance measures that are described in the NOFO. We have provided a logic model, an example logic model outlining activities and proposing some examples of short-term, intermediate-term, and long-term outcomes. So the short-term outcomes are outcomes that you can expect to achieve within 1 to 2 years. Intermediate outcomes are those that you can expect to achieve within the period of performance. So that's the 3 years, the total 3 years. And long-term outcomes are ones that you may not be able to achieve within the period of performance, but are the ultimate goal of what you are proposing for your activities. So within the work plan, programs must identify 2 or more short-term outcomes and at least one long-term outcome on which your program will be focused. So outcomes can be modified from what we list in the logic model. The logic model provides some examples and guidelines in case you're trying to figure out what we're talking about. But you will be responsible for tracking the progress, measurable progress towards achieving those short, and intermediate outcomes during your period of performance. So keep that in mind. We want them to be measurable, and that there are data that can track how well you are achieving those outcomes. All right, so the next few slides are a little bit more about the objective review criteria. And this can be found at the very end of the NOFO and details exactly how applications will be judged. So this is particularly important that you respond to and account for every single item that is listed in the objective review criteria. So all applications will be judged on these criteria. They're the same criteria for everybody. Everybody who is eligible will be judged on this on these criteria. The total points are out of 100 points. So the first section is the approach section, and there are 45 points total that can be allotted to the quality and completeness of the approach. So this is the section where you'll include your background, statement of the problem within the community. You'll be able to discuss your program purpose and outcomes that you hope to achieve. And again, you'll be identifying 2 or more short-term outcomes and at least one long-term outcome that you hope to work towards. So the short-term outcomes should be achieved within the period of performance, and we want you to be able to describe how you're going to achieve them, how you're going to measure them, and what types of data collection tools and measurements will be involved in that process. The long-term outcome, again, we don't expect you to necessarily be able to achieve within the period of performance, but we would like you to be aiming for that achievement following the period of performance. So a large portion of the points that are in this section are awarded for discussion of the strategies and activities. This is where applicants will list 1 or more of the strategic areas that they've chosen, address a timeline that you are proposing to achieve them in, describe how the year 1 activities will also build into your overall 3-year program outcomes. So please read through each of those elements and make sure that they are all included in your approach to this NOFO. So the next section in your objective review criteria are, this is the evaluation and performance measurement section. So there are 30 points that are available to judge the evaluation and performance measurement components of your application. So this section relates to the detail and feasibility of your evaluation. So how are you judging whether what you did, whether you were able to accomplish what you were doing, and how successful you were throughout this process. So programs should describe how their data will be collected. And if you don't have a current data collection tool, you can even describe what you would propose. You don't have to have finalized data collection tools available at the time of application. But you should also, let us know how you plan on collecting those data. Is it going to be a survey? Are you going to collect, numbers of tick preventives given out or numbers of spay and neuters performed? Those kinds of things. So please be specific. And 5 points of these total 30 are specifically for providing or describing your data collection tools. So you really do need to let us know how you plan on collecting these data. All right, the next section is the applicant's organizational capacity to implement the approach. So there are 25 points that are allotted for this section. And these points are really there for demonstration that the tribal government can feasibly do what you are saying that you will do. So you need to demonstrate that you have the capability either by current staffing or the plan to hire new staff, and you have the organizational support in order to implement the work plan. Again, if you are planning on hiring somebody in order to conduct the work plan, then you will need to let us know that you plan on hiring them, that this is what you are looking for, the duties that you hope that they will cover, and the length of time that they will need to be hired. Applicants are also asked to submit a detailed budget. You can see that there are no points ascribed to the budget itself. So you are not evaluated specifically on the budget, but we do want it to be, it's not scored, but we do want it to be reasonable and consistent with the activities that you have proposed in your work plan. So making sure that what you have in the budget, what you have in the budget narrative matches up with what you're proposing to achieve. And then lastly, we do have a mandatory requirement for the evidence of disease incidence. So this is where, we would need you to provide evidence of the burden of disease within your community, of the burden of Rocky Mountain spotted fever within your community. Again, this is not a scored element, but will help us to establish which funding tier you are eligible for. So again, this is human cases of Rocky Mountain spotted fever during 2015 through 2020. So next, I'd just like to review the major points in our timeline. So the NOFA was posted on March 8th to grants.gov. We are having our informational meeting right now, today on March 24th. Applications will be due to grants.gov on May 14th of 2021. So that's about a month and a half from now. And that will be due by 11:59 Eastern time. So please do keep in mind that the time that the application closes is based on the Eastern time zone. We anticipate that the award will be issued on August 1st, although this may be a little bit delayed depending on processing times at CDC, but we will alert you to any changes. Next, I'd just like to provide you with access to my contact information. So I'm, again, Naomi Drexler. You can reach me at by email or telephone. That's isj3@cdc.gov. We also have very wonderful points of contact with the Office of Grant Services. Kathy Bradwell is our Grants Service Officer, and Brownie Anderson Rana is our expert on the line today, I hope. So helping to answer some of those more specific technical questions about the grant. And you can feel free to reach out to any of us at any point during this application process. If we can't answer or can't provide any clarification, we'll let you know. I think we can go ahead and open this up for questions. I think, Jeff, would you mind unmuting everybody in case there are questions and relaying any questions that are on the chat?
Yeah, sure, Naomi. It looks like I went ahead and unmuted everyone. So if you have a question, feel free to unmute yourself and ask your question or put it in the chat box and I can communicate that to Naomi. Naomi, right now there's none in the chat box.
Great. And again, if you are joining us by telephone, you may need to unmute yourself both on your phone and by pressing *6, I believe.
Hey, Naomi, we have a question in the chat. It says, if you select to do communication in year 1, but would like to change to implementing the evidence-based strategy in year 2, would that be acceptable?
Yeah, that's a great question. Yes, I think that would be acceptable to switch your tactics within year one to year two. But what I would like you to kind of keep in mind is some continuity to your application. So, you know, if those elements build onto each other, it might be nice to kind of add one in year two or year three, but continue what you have started with the communications. So rather adding on rather than replacing. Great question. Another question that I have received offline has been whether you have to apply for funding in year one in order to be eligible for funding in years 2 and 3. And our answer to that is yes, you do need to apply for funds in year 1 in order to be eligible for funds in years 2 or 3. You know, funding amounts can vary depending on the needs of the tribes and obviously the availability of funds from our program. But we only plan on making this NOFO open for competition in year 1 at this time. I want to encourage people to feel free to come off of mute if you have a question. You know, I think we all learn well from everybody else's questions, and also make sure that I'm thinking of all possible different contingencies. So please feel free to either type something into the chat and Jeff can direct the question to me, or feel free to come off of mute.
Hi, Naomi. This is Gil Kirsch from Rickettsial Zoonosis branch.
Hey, Gil.
Hey, I just wanted to thank everyone for being on the call. And I know the federal grants process can be intimidating. I encourage you to reach out if you need help deciphering anything. And also want to thank everyone for the ongoing commitment to Rocky Mountain spotted fever prevention that is evident in all the tribal communities in Arizona. So thank you for that, and hope to be able to complete this process of getting funding out.
Thanks, Gil. So I realized that, you know, it's very early on, and the application was just, or the NOFO was just posted a few weeks ago on March 8th. So this may be very new to you, and it's a very lengthy document kind of detailing the process for how to apply, what we're expecting. As Gil said, just feel free to reach out if you have questions as you're going along and putting together your application. we've tried to provide some, summary terms and explain examples, like with a logic model of what we're expecting for short, intermediate, and long-term outcomes. But I know that many of you are just starting to think about this right now. So we would encourage you to reach out. But if you have other questions at this time, it's good for everybody to hear kind of what you're thinking. I'm going to turn this back to the NOFO contacts as well, in case we went through that fairly quickly. So these are my contact information, as well as our points of contact in the Office of Grant Services. Kathy and Brownie have a ton of experience working with grants.gov, so they might be able to help you troubleshoot if you're having trouble getting access to your account, or if you need to, ask something specific about what are allowable funds for your budget as well.
Hey, Naomi, we have another late-breaking question in the chat.
Great.
It says, would the grants run from September 1st to August 30th?
That's a great question, and please correct me if I get this wrong, Jeff, but the grant will typically run from the award date up through 3 years following that. So each year you'll have to submit a continuation for your application to continue. You'll have to submit a report of what you did within that year and a proposal for the next year. But if the award begins on September 1st, then the year one activities would be from September 1st through August 30th of the next year. Is that correct, Jeff?
It is, yeah. It just all depends on when the start date of funding happens and when the notice of awards are issued. As Naomi said, every year there'll be a report due and then a work plan that will need to be submitted that we'll be reviewing every year. So that's the difference between project period and budget period. In 3 years, there'll be one project period, but 3 budget periods, one for each year during that time. But feel free to ask any more questions about that process too, because it can be confusing as well. And Naomi, the next question is, do we submit the budget for just the first year?
That's also a really great question. Yes, please submit the detailed budget and the budget narrative for just the first year. So each year, we'll let you know what we anticipate the size of the award being for the next budget period, as Jeff mentioned, when you submit your continuation. So for year one, we anticipate awarding $350,000 as total among all awards that we issue. And then, so you will need to submit a budget and a budget narrative for the year one activities. We would like you to go into a little bit of detail in your work plan about what you plan to accomplish within year one specifically. We'd like you to address, where you are going for the entire period of performance for the 3 years, but also specifically what you hope to accomplish in that year one. And then the budget should match up with that. Some other questions that I anticipate might be relevant for many of you is whether you need to have memorandums of understanding or subcontracts that you plan on implementing in place at the time of the submission of your application. And no, we do not expect that you will have subcontracts in place at that time, but we do want you to, in your organizational capacity section, mention how you plan on bringing on any subcontracts or partnerships. If you have any current partnerships that are important for your accomplishment of the proposed work plan, it makes a stronger application if you can include letters of support from many partner organizations. Say you're partnering with a nonprofit for spay and neuter services. So if you plan on making that part of your work plan, a letter of support from them would strengthen your application. Again, not required, but adds to the organizational capacity. And Jeff and others, other panelists who've been involved in this process, if you can think of other questions that you hear frequently in other extramural programs or want to share, then I'd be happy to address those as well.
Yeah, thanks, Naomi. I think you've covered most of it. I think it might be good to make everyone aware that you will be providing that FAQ, which will cover a lot of questions that we anticipate or have received in the past about these types of processes. Certainly reach out to us. We know it can be somewhat intimidating applying for this funding, as Gil noted, and we're happy to help, and we're happy to help you interpret what certain things mean. And so reach out to us or reach out to OGS if you have any questions on that. Naomi, there was one other question that came up in the chat box. It says, can you go over the timeline due dates again? I think you had a slide. Yep, there it is.
Yeah, absolutely. So applications, the upcoming due dates are going to be, so the applications are due May 14th by 11:59 p.m. Eastern time. And then we anticipate that the award will go out on August 1st, although that is subject to some, internal processes at CDC in order to get, the funding packages put forward and everything. But we hope that it will be August 1st, and we will inform applicants if that award date changes. Also included, what we'll include in the FAQ is some resources. If you're new to grant writing, I know that can be, it's a whole different language of itself that I'm having to rapidly learn as well. So we're going to include a couple of resources on writing grant applications, on understanding the grant process, how to build, logic models and budgets and things like that. So we'll provide some links to a few resources within our FAQ. So I realize we are getting to the end of our hour scheduled for this webinar. And of course, we'll be happy to stay on the line and answer any questions. Again, feel free to email questions or give me a call if you have other questions. As we've discussed earlier, we're going to post this webinar, the video of this webinar, as well as it'll have a transcript connected to it with what was said. And we'll also post the frequently asked questions that we've kind of put together, and we'll include the responses from today's discussion. We'll post that on the CDC NCEZID partnerships website, and I will email out that link to those included on this call, as well as our tribal governments leadership, who I've already reached out to about this. So we'll make sure that link goes out so that you have easy access to it. The slides will not be specifically available, but the slides within this video will be available. I think we are nearing the end of our time. So if you have not already done so, please place into the chat your affiliation if you are willing to share it. It looks like we've got some partners from ADHS, IHS, and White Mountain Apache Tribe on the line. So thank you all for participating. If we have not caught your affiliation and you're willing to share it, please just add that to the chat. Just so we can kind of keep a record of who was included in this call. So since this, you know, I know not everybody can always make a webinar, but please feel free to share this, you know, this webinar link when it goes out, or information about this NOFO with any tribal entities that you think are eligible. We hope that you will share this broadly so that all parties that are eligible to make an application will consider doing so. All right, I think that does draw us to the close of our hour allotted for this webinar. Again, please feel free to reach out to me either by email or call me. I hope most of you know me and have my contact information. We'd be happy to answer any questions about the application or clarify any concepts. But I'd really like to thank you all for participating in the webinar today and for your interest in our NOFO. We are very much looking forward to this opportunity to provide direct-to-tribe assistance, and hoping that it will prove valuable for you all as well in terms of building your capacity to carry out Rocky Mountain spotted fever prevention and control activities. The hard work that you guys are already doing, just kind of give a little support and make it a little bit more sustainable is our goal. So thank you all for your time. This concludes our webinar for today.